Okay, I want to start by introducing our speakers for today are with the Sandstone Center for Neurofeedback in Shenandoah, Texas. And first we have Dawn. And Dawn is a clinical manager for Sandstone uh, Center for Neurofeedback. She was a client at Sandstone long before she became an employee. And Dawn has a BA and an MBA in business administration from Laterno University and has her neurofeedback technician certification through the Biofeedback Certification International Alliance. Dawn has two sons with mental health disorders, one with autism. As a result, she has also been a dedicated mental health advocate for over 15 years. And alongside Dawn, we have Dr. Kaufman, and Dr. Kaufman is she's the clinical director at Sandstone Center for Neurofeedback. She's a 1991 graduate of the National College of Chiropractic in Lombard, Illinois. Her postgraduate work and specialty is in acupuncture. She received her diploma, her diplomat degree from the International Academy of Medical Acupuncture in December of 2011. Dr. Agnes became interested in brain health after she lost her mother to Alzheimer's disease in 2018. Dr. Agnes received her board certification in neurofeedback at the clinician level from the Biofeedback Certification International Alliance. And with that, I'm just going to turn it over to you ladies.
Great. Yes, thank you. It's so nice to be here.
Yeah,
Thank you for having us.
Super excited to be here.
Yeah, it's no great mystery that the health of our brain impacts mental health. And one of the main tools that we use here in the Neurofeedback Center to assess brain health is a quantitative electroencephalogram, a QEEG, or a brain map. And I'm going to turn it over to Dawn to let her explain exactly what a brain map is.
Yeah, so brain map, like Dr. Agnes said, is actually a quantitative EEG. It teases out brainwave activity and helps identify areas of the brain that have dysregulated brainwave patterns. It's these dysregulated brainwave patterns that cause most of the symptoms of mental health issues or cognitive issues. You can see many of them listed here. A lot of symptoms like anxiety, depression, difficulty with concentrating, lack of focus, racing thoughts, impulsivity, insomnia, lots and lots of different symptoms come from dysregulated brain waves. So this QEEG is the tool that we use to determine if you have any of these dysregulated brainwave patterns. It's a pretty simple test. Like I said, it really teases out only electrical activity. So we're only looking at the different types of brain waves, nothing else. There's no imaging or anything like that. Patients come in, they wear this goofy looking swim cap hat with holes in them. We put some conducting gel in all those white holes. The ribbon will be connected to the computer. They do part of it with their eyes open and part of it with their eyes closed. Your brain fires very differently when your eyes are open because of all the stimulation around us. It looks at 19 different areas of the brain. So basically front to back, ear to ear. It's looking at things like the size of the brain wave, the speed of the brain wave, how the left side of the brain wave communicates with the right side, and how balanced the left side of the brain wave is with the right side. It compares how your brain is firing to a very large database. Neurofeedback's been around over 65 years. There's over 1 million maps in the database. But it compares the way your brain is firing to other people your age. So they compare by age, not by gender or ethnicity or anything like that. A 6-year-old's brain does not fire like my 55-year-old brain, right? And my 55-year-old brain doesn't fire like an 80-year-old brain. Well, sometimes it does, but it's not supposed to. So it compares the way your brain is firing to other people your age, and it prints out a nice report with both text and pictures. But the gist of what it shows us is it shows us, okay, where is your brain firing in the normal range? So let's say I'm going to use this visual quite a bit. Let's say this represents the normal range where we kind of want your brain waves ebbing and flowing. If our brain is firing in the normal range, then our moods are stabilized, we're cognitively at our best, like we're sleeping great at night, the birds whistle when we walk by, all is right with the world. So the brain map helps determine, okay, where are we firing in this normal range in a regulated, balanced way? And then where are we firing outside of that normal range, either too much or too little, too high or too low? Anytime our brain fires outside of that normal range, those are called dysregulated brain waves. Now, any part of our human body, any part of this machine can become dysregulated at any time. You know, the difference is like if your blood sugar becomes dysregulated, you feel that because you kind of sink, right? But when your brain waves are dysregulated, you know, you can't really feel it. You can't touch it. You can't taste it, but it manifests in those mental health symptoms. When we look at the brain map, as I mentioned, it looks at 19 different parts of the brain. I won't go over all of these, but really each part of the brain, of course, has different functions. For example, if you look at the front of the brain, sort of the top here, you'll see like FP1, FP2, and then the row behind it that starts with F. That's our prefrontal cortex and our all of our frontal lobes. That's where a lot of our executive functioning happens. So things like task completion, decision making, our working memory, attention, our focus, our concentration. Also things that can get in the way of that, like obsessive thinking or ruminating on negative thoughts or impulsivity. Those are the types of things that happen in the front of the brain. For contrast, in the back of the brain, in the occipital, which are the O's, and the parietal lobes, which are the P's, that's where a lot of like our visual processing happens. So when looking at how our brain is impacted, you know, different conditions target different parts of the brain. For example, one of the more common conditions we treat in our clinic, especially for our kiddos, is ADHD. And ADHD generally has a lot of dysregulation in the front of the brain, in that prefrontal cortex and those frontal lobes. But you can see it's pretty complex. Every part of the brain is responsible for a different function. Okay, and that's about where my knowledge base ends. No, I'm just kidding. We like to trade off. When we do training, everybody calls us Lucy and Ethel. So I always like to explain it kind of in simplistic. I use a lot of analogies, and then I'm going to let Dr. Agnes kind of go a little bit deeper in exactly what the brain map tells us in relation to our specific brain waves.
So, like Dawn said, we're measuring the brainwave activities at these 19 different locations. We're measuring the delta waves. They're the slowest waveform. They're generally associated with deep sleep. Then you have your theta waves. That's if you're half awake, you're half asleep, you're daydreaming, you're visualizing something. Alpha is, hey, I'm awake, but I'm relaxed. My mind is just idle. And then the beta waves are your cognitive waves. They have the broadest frequency band. They go from 15 hertz all the way up to 30. Our system divides them into two different groups. It calls the 15 to 20 hertz beta, and then the 21 to 30 hertz, the high beta. It's really the 15 to 20 hertz beta wave that's associated with a nice calm focus. The 21 to 30 hertz beta is, oh my goodness, there's a saber-toothed tiger chasing me.
Right.
So
yeah, so you
so what we have pictured here, it's not one of our full brain maps, but we thought it would be nice to kind of give you an idea of what the brain map report looks like.
Yeah, our brain map's pretty thick. There's lots of
Yeah.
pages. So this is just a snapshot. It's actually half of one page, really.
Yes,
Yeah.
this is two sections of the brain map. So this was the brain map from a 15-year-old male. He had been diagnosed with anxiety, autism, ADHD. He was very impulsive, and a lot of that impulsivity was emotional. He was having outbursts. And at 15, it was, you know, a lot of anger, you know, and it wasn't like a slow simmer up to a boil. It was pretty rapid. I mean, that anger could come on pretty quickly. And when we look at the brain map, the first section that we look at is the magnitude. And so that's the size of the brain wave. And it shows you the different brain wave types and where the magnitude is at each of those 19 different locations. I don't know if you can see the screen well enough to see the different colors, but the key is the same for all of the waveforms. Where you see green, that's where the brain waves are in Dawn's perfect processing zone. Where you see red, they're above that zone by 1 standard deviation. Yellow is 2 standard deviations higher. And then if we look on the other side of the scale, the light blue is 1 standard deviation lower. The dark blue is 2 standard deviations below. So we get a rainbow. What does it mean? And this is where they've done a lot of studies in neurofeedback. What is it associated with when these different circles turn different colors? You can't really use a brain map to make a diagnosis, but when they took people who were diagnosed with ADHD and they said, hey, are there any patterns that they have in common on these brain maps? Like Dawn said, it's an executive function problem. So they have a lot of dysregulation at the front of their brain. And the pattern that they found, when you look at the ratio of slow wave activity to fast wave activity, you have a lot more fast wave. So when we look at the delta and the theta waves, those are our slower brain wave forms. We see a lot of red and yellow. They're 1 to 2 standard deviations higher. Then when we look at their beta waves at the front of the brain, they're mostly blue, right? So they're lower there. So that's a pattern that we see with ADHD. Having high delta and theta at the front of your brain, if this child's brain were a web browser, he has 15 tabs open at all time, right? The selective attention is much lower. Is much higher. The sustained attention is much lower, and it drives parents crazy because they'll be like, I really don't think he has an attention problem. He can focus on that video game for 8 hours, but he can't give me 8 minutes on his homework. And I'm like, well, he loves the video game. That's selective attention. It's actually higher, so he can hyper focus. He hates math, so that's his sustained attention and it's lower. So no, he really can't give you that. And then other conditions like autism, the saying, if you've met one person with autism, you've met one person with autism. Because the spectrum is so broad, there's no one pattern that you can look at a brain map and say, oh, everybody with autism has this pattern. And with emotional outbursts, like the high temporal theta, so the T3 and T5 on that left-hand side, and the T4 and T6, when those areas of the brain waves are higher, it can cause emotional flooding. So if something happens, and to me on a scale of 1 to 10, it feels like a 2, when you have that red temporal theta, you don't feel it like a 2. You feel it like a 6 or a 7. And then this, patient also had the low temporal alpha, which makes it more difficult to control your emotions. So here they're having a bigger emotional response and a decreased ability to control it. So that would account for the emotional outburst. And when someone comes into the office and they want to know, am I a good candidate for neurofeedback? If I can see the symptoms that they have on a brain map pattern, then I can train that brain to get into that more healthy, balanced pattern. And the way we do the brain training is with neurofeedback. And so I'm going to turn it over to Dawn, and
I'll tell you a little bit about neurofeedback. So, I think the title today was No Tricks, Just Treatment. So we're going to talk about several alternative methods of treatment. Probably we'll spend the most time on neurofeedback just because that's our primary therapy that we do here, but we do some others. So we're not just going to cover neurofeedback, but we'll start there as sort of our Mac Daddy therapy, what we do. That's what we do the most of. So neurofeedback, if you're not familiar, is actually biofeedback for the brain. It is
EEG biofeedback.
EEG biofeedback is, yes, biofeedback for the brain, hence the name neurofeedback. It's a form of operant conditioning. So really we are helping the brain do something it already knows how to do. So you guys probably know, but your brain has this thing called neuroplasticity, which is the ability to rewire and retrain itself. And really what we're doing is taking advantage of that neuroplasticity and helping the brain rewire, make new connections to dial that high that she showed you, that red and yellow down, and to kind of bring that blue up so that we can get the whole brain balanced and regulated. The way they do that, now I just want to say this is not a picture of our office because this looks so cold and so sterile, but it's hard to find neurofeedback pictures. We're like a unicorn. But it does kind of demonstrate what's happening. So you come in, you sit in a big comfy chair. We place two small sensors, they're very small, about the size of my fingernail, on the scalp. And where we place them on the scalp is dependent on what the doctor sees on the map. Where are you firing in that dysregulated pattern? So for like the ADHD patient that we've kind of been talking about so far, we're going to be probably placing those sensors on the front of the scalp in that prefrontal cortex where that executive functioning is happening. They wear a set of headphones on their ears. In front of them is a television screen, and beside them is a computer screen. They pick a show like on Netflix, like literally whatever, streaming show they want to watch, as long as it's not super scary. They pick a show on Netflix, and then as far as they know, they're just kind of honestly chilling out watching TV. But on a subconscious level, their brain's working super hard, like we're sending the brain to the gym. That computer that's alongside of them is actually monitoring their brainwave activity in real time. So your brainwaves are not static. They don't go like this. They kind of bebop around. So every time that computer catches the patient's brain firing in that range that we're looking for, the screen on the television stays bright and the volume in the headset stays at a normal range. Then every time the computer catches the brain kind of firing outside of that range in that dysregulated pattern, the screen gets a little bit darker and the volume gets a little bit softer. Now I'm going to show you an example here in a minute, and you'll see it is the faintest of flickers. In other words, it's not super bright, dark, deafeningly loud. It's a very faint flicker. But the brain does not like the flicker, does it, Dr. Agnes?
No, the brain craves stimulation.
Brain craves stimulation. That's why we're all hooked on our phones and the kids are all hooked on video games. In fact, your brain actually needs stimulation to survive, but it craves it. So the brain wants the screen to be brighter and the volume to be louder because that's more stimulation. So when the software makes it flicker and go a little darker and a little softer, your brain goes, you know what, I don't really like that. So what happens over time, research shows it typically takes about 60 to 80 sessions for us to form a new neural pathway, a new connection. But what happens over the time is, your brain's a pretty smart animal. So it says, you know what, hey, the only way I'm getting that positive feedback that I want, that brighter screen and that volume up, is when I fire this way. Because when I don't fire this way, I don't get that reward. I don't get that feedback I'm looking for. So the brain will naturally start firing that way more and more and more. And because of that neuroplasticity thing we talked about, anytime our brain does something over and over and over again, it will form a new connection. It just says, you know what, let's just make this the way that we fire. So we are creating new pathways here. We are rewiring the brain. For the most part, neurofeedback is a permanent change. There's always exceptions to that. But this type of therapy is all natural. We're not anti-meds, but there's no medication involved in what we do. It's non-invasive. We treat ages 5 and up. The kids love it. It's 30 minutes of screen time. They get to come in and watch Mickey Mouse and then they'll get hollered at for it. And then they get a lollipop. So it's a very relaxing therapy. But really, we are just kind of taking advantage of what the brain already knows how to do. We're just kind of pushing it along. If you're somebody like the case study that you put up, you're somebody that's had a lot of ADHD and a lot of impulsivity and excessive thinking, those thought patterns are very difficult to override on your own. So neurofeedback gives us the ability to help people override those thought patterns. And when we do that, we kind of bring all of those dysregulated brain waves back into that normal range, and that creates a symptom reduction. Now, one of the first things we tell any patient that comes through our door when they very first meet with Dr. Agnes or myself is this is not I always say this is not magic fairy dust. There's no crystal balls involved in this or hocus pocus. This is not a cure. Neurofeedback is really a quality of life therapy treatment. If we can balance and regulate each part of the brain, it will create a symptom reduction and improve quality of life. As they mentioned in my introduction, my two boys did neurofeedback here 7 years ago. They were two of the very first patients when our clinic opened. One of my sons has autism. He still has autism. Like, I can't make that go away. But the symptoms associated with his autism were greatly reduced. Or if you come to us with depression, I can't make you never sad again, right? That's a normal human emotion. But if you're experiencing extreme depression that's keeping you from, showering and going to work and those kinds of things, we can get it in a range that's much more manageable so that you're able to function. So that's usually how we explain it. So I want to show you an example of just a 30-second video clip of a neurofeedback session. But before I play it, I want you to know what you're looking at, okay? So you're going to see our patient, switch screens here, sitting in that big comfy chair that we talked about. You'll see the headphones on his head. And in just a second, it will pan to the television that's in front of him. And I want you to really closely, don't take your eyes off the screen, because that faint flicker that we talked about is pretty faint. And I want you to note that you can't hear it, but in his headphones, every time the screen goes a little darker, the volume in his headset at the same time gets a little softer, okay? So I'll play it. It's very short, but it'll give you a chance to see kind of what's going on. So there's the headphones sitting in a chair. Now watch the screen. There it went flickered. There it flickered. There it flickered. He's a nature show guy. There it got brighter, darker. This is a veteran that has PTSD, this client that you see. And then there's the computer that's alongside of them, monitoring all that brainwave activity in real time. You can see we're working in that front part of the brain, just like we were mentioning earlier. And so it's really all software driven that's making that TV and that volume lighter and darker. So that's just kind of a quick little glance at what it looks like in real time. So it's a super relaxing therapy. This is the primary therapy that we do here in our office, but it's not the only thing that we do. So I'm going to let Dr. Agnes go over some of our other therapies, and we'll start with our brain-based therapies.
That sounds good. One of my favorite analogies for brain health, I actually stole it from Dr. Bredesen. He wrote the book, The End of Alzheimer's. And he said, when you have Alzheimer's, your brain is like a roof with 36 leaks and medicine plugs one hole. I think brain health in general is like a roof with several leaks. And when we first opened the clinic, we didn't have as many therapies as we do now. We basically did the neurofeedback therapy, but as we go to conferences and we learn more and more things are being developed all the time, we've added, these therapies. Like Dawn said, we're not anti-medicine. Sometimes medicine plugs a hole, neurofeedback plugs a hole, oxygen therapy plugs a hole, counseling plugs a hole. The more holes we can plug, the better the health we're going to get, the better level of health we're going to get that brain to. So when we do our oxygen therapy, we actually combine it with whole body vibration therapy. As you can see, it's not a hyperbaric chamber. The patient wears an oxygen mask, and they're standing on a whole body vibration plate that's shaking them. They've done a lot of studies on shaking. Have you ever noticed when you're nervous, your hands might shake, like mine are a little bit now because I don't like public speaking? Or if someone's having a panic attack, their whole body might be trembling. And so when they looked at what's going on at the level of the nervous system, they found that whenever you shake, you decrease the firing of your limbic system, and it can help you to feel calmer. Shaking also improves neuroplasticity. You have specialized nerve cells outside your joints. They're called mechanoreceptors. They tell your brain what position your joint is in. Your brain needs to know that. If I want to straighten my elbow, my brain has to know it's bent in the first place to know what muscles to activate to allow the movement. So when you're standing on a whole body vibration plate, those mechanoreceptors are going a little bit crazy, right? Because the foot's plantar flexed, it's dorsiflexed, it's inverted, it's everted. All that information travels from those mechanoreceptors to the nerve in your leg, to your spinal cord, to your brain at 265 miles an hour. So that brain is getting a lot of stimulation. So stimulating new neural pathways helps improve that neuroplasticity and helps it change out of the pattern it's in and into a more healthy, balanced pattern. So we have the person standing, sorry, Dawn, you know I love my neuroscience.
I know. Don't worry, guys. I'll cut her off if she geeks out too much.
All right. So then the person's wearing an oxygen mask. Here at sea level, our atmosphere is 21% saturated with oxygen. When you put that oxygen mask on, it's not going to feel like you're at sea level because it's going to put you in a low oxygen state. You're only going to be getting about 12% oxygen. That would be an elevation of about 15,000 feet. Now we're going to ask the patient to march while they're on that vibration plate. So they're exercising, they're breathing in less oxygen, but they're blowing out just as much carbon dioxide. Over time, and it usually only takes about 3 to 5 minutes, that oxygen saturation level is going to start to drop. They're wearing a pulse oximeter on their finger. When they start, they're usually 98 to 100% saturated. When they get down to about 95, 94% saturation, the machine kicks you into high oxygen gear. Now you're breathing 96% oxygen. Every single hemoglobin molecule in your blood is saturated. Partial pressure of oxygen in the blood is very high. We made it very low in the tissues in that early phase. So you push more oxygen than if you were just breathing the 96% the whole time. They've done a lot of studies on it. The technical name is hypoxia, hyperoxia interval training, HHIT. Athletes recover from injury quicker. It can increase cognition. When they did a study in a memory care center by 16%. Another therapy we do is pulsed electromagnetic field therapy, or PEMF. PEMF was initially developed because they found that it helped bone fractures heal. And the way it does that, the pulsed electromagnetic field therapy helps your mitochondria make more energy. The more energy your mitochondria has, the greater the capacity for healing. When someone has had a chronic anxiety or a chronic PTSD, a complex PTSD, their brain has been in that excited state for quite a while, and it can be metabolically very drained. And that's a patient that's going to respond very well to the PEMF. In 2015, the Food and Drug Administration approved the use of TMS to treat depression. Some of you may have heard of TMS. It's transmagnetic stimulation. Transmagnetic stimulation is a form of pulsed electromagnetic field therapy, just a different delivery device. And then we also do photobiomodulation therapy. It's a mouthful.
It's a mouthful.
It's a headset that you wear. It sits on the scalp like it's shown in the pictures. It's near infrared light, 802 nanometers. We have 2 different frequencies. We have an alpha frequency and we have a gamma frequency. The alpha frequency is that 8 to 12 hertz. That's associated with, hey, I'm awake, but I'm relaxed. Okay, here comes the warning, neuro geek. Where the diodes touch your scalp, it's over a series of connections in your brain called your default mode network. That's what generates our internal dialogue. And the way the default mode network is supposed to operate, when you close your eyes, you activate it. And that's why a lot of people will be like, wait a minute, let me think, because we block out the outside world and we turn on the inside world. When you open your eyes, default mode network is supposed to dial back so you can have better focus out here. Studies have shown people that suffer from ADHD, anxiety, even autism, and all of those subgroups of patients even though their eyes are open, default mode network is still running. So sorry, I can't focus out here. I have my own world going on in here. In fact, some of your outside stimuli can be a little bit uncomfortable to me. And then the gamma hertz frequency, they're doing a lot of studies with the gamma frequency and Alzheimer's disease. They're finding that that gamma frequency can improve cognition, improve memory, improve focus. And then heart rate variability training is just slow, steady breathing, teaching the patient. We have a program, it's a little ball, it rolls up a hill as you breathe in and it rolls down the hill as you breathe out. Whenever our brain gets in a more excited state, it tends to affect our breathing, and the heart rate variability will change. When your heart rate variability is very steady, the brain is in a more calm place.
All right.
And yeah,
Oh, I was just gonna say, and we were also just gonna touch on some things that you can do, at home if you're, for the average person where we don't, they might not have access to all of these fancy therapies that we do here in our
Yep.
clinic. So we'll let Dr. Agnes go.
Dawn laughs at me, but I had a magnet made for people to put on the fridge with a lot of these things on. I still think it's a good idea.
Okay, we'll go with that. We'll
Yeah.
go with that.
But I don't have it in BA.
That's right.
So, mindfulness can be very helpful. It ties into what we were just talking about with that default mode network, because when you practice mindfulness, you're focusing on the right here and the right now. A lot of times with anxiety, we're worrying about some future event. Sometimes with depression, we're ruminating on something in the past. We're not in the right here and the right now. And when you do mindfulness, it decreases the firing of that default mode network, so it can bring your brain to a more calm place. Meditation, they've done a lot of studies with meditation. They found that it actually increases the gray matter in your brain in areas that are associated with emotional regulation, with attention, with self-awareness. And it too decreases the firing of the default mode network, as does prayer. They've done a lot of studies on prayer. They did one study and it showed if you prayed for 12 minutes a day, your cingulate cortex would actually increase. The cingulate cortex is the part of our brain that helps us feel empathy and also helps regulate emotions. Other studies have shown that prayer helps repel negative thoughts. And it also, prayer helps to balance the autonomic nervous system. So that balance between sympathetic and parasympathetic, it can help get us out of that freeze, fight or flight mode. Gratitude, when you're practicing gratitude and expressing heartfelt thanks and appreciation, it actually makes it much more difficult for your brain to make the stress chemicals, the cortisols, the epinephrines, the adrenalines. Journaling, sometimes writing down an experience to kind of help release it can also decrease the firing of that default mode network. Diet, they've done multiple studies on diet and how it affects the brain. They're even calling Alzheimer's now diabetes type 3. It's where you don't have diabetes, but you have lots of peaks and drops in your blood sugar. Our brain burns glucose very well, and it likes glucose as a fuel source, but it likes a nice steady stream. It doesn't like the peak and drop, That's very inflammatory. Exercise, right? I can't think of a study where they said exercise hasn't improved.
Right.
Darn it. I know. Can't be sitting on the couch eating bonbons that does all these good things, right? But if you look exercise, right, it decreases arthritis, decreases the risk of Alzheimer's, it relieves stress, it improves just mental health in general and sleep. Do you know that 30 to 46% of people in the United States today report that they don't get adequate sleep? When we're in the deep phase of sleep, the pressure of our cerebral spinal fluid actually decreases. So more of it can come up over the brain and actually, it's almost like washing it and getting rid of toxins. When you're in your dream phase of sleep, is when we store memories. Do you ever have that experience where you're having a dream and it might be a little snippet of your day with a twist on it? That's the brain storing that memory. We also do problem solving in our sleep. I think we've all had the experience where you're working on something and you reach the point of frustration. You can't solve this problem. Then you go to bed, you wake up the next morning and you're like, oh my God, that's it. That's the answer. That happened in your dream sleep. Social activity. I mean, we all saw what happened during COVID when everybody socially isolated. Anxiety rates went up, rates of depression went up. Social activity, lack thereof, has been linked to an increased risk of Alzheimer's, because as humans, that social interaction and connection is very important for the brain. And most of my teenage patients hate when I say they need less screen time. Not only is the blue light emitted by the screen excitatory towards the brain, but a lot of screen time can actually make the symptoms of ADHD exacerbated. Do you know the average time someone spends on a screen when they're scrolling is 20 seconds? I mean, what are you training your brain for? 20 seconds and change, 20 seconds and change. And screen time can also exacerbate anxiety as well. You know, that constant information all the time. So those are just, you know, things that everybody can do.
Yeah, we wanted to try and, give a balance of options, sort of a menu, if you will, a variety of different therapies that can certainly help improve brain health and mental health, all the way down to easy ones that anybody can do at home. So with that said, I know we wanted to make sure that, we were told to make sure we kept it within the hour, and we always like to allow time for questions. I feel like sometimes questions is where the most learning happens. So we're happy to open it up and answer any questions that you guys have related to anything we talked about or anything else. Well, alrighty then.
Well, thank y'all so much. This has definitely been informative. I have my question that has been coming up is, you said that around 60 to 80 sessions of neurofeedback is typically what it takes to retrain. Is that, what about follow-ups? Do they have to come back in and get a checkup every so often, or how
That's a
does
great
that?
question.
It is. And prior to the pandemic, when somebody finished their care, I was like, your changes are permanent.
Like my kids.
Yeah.
My
like-
kids, yeah,
Yeah.
7 years ago. Yeah.
Yeah. Because once you make the changes, they're permanent. There are two things that can affect that permanency. God forbid, any physical brain trauma, any concussion, or
Stroke.
stroke, any, physical brain trauma, or any major emotional trauma. I stubbed my toe. Is that going to do it? No. But I lost a beloved family member. Yes, that could do it. Any major emotional trauma can make the brain, I call it the path of least resistance, right? Your brain gets firing in a pattern over and over again, it meets less and less resistance. Perfect example. Sometimes on a Saturday, I don't want to come to this office, it's closed, but I'm going to the grocery store that I pass every day on my way to work, and I forget my grocery list. So now I'm ruminating on my list. What was on that list? What was I going to make for dinner? I'm driving, but scarily enough, I'm focused all about this list. And the next thing I know, I've driven past the grocery store I'm like 4 streets away. I'm a block away from my office. I'm like, my goodness, where am I going? Right? But when I get in my car 5 days a week, that's the path my brain fires. If I don't override it, that's the path of least resistance. That's where it's going to take me. Now imagine it's a thought process, right? And you don't fire that pathway once a day, 5 days a week, but maybe once an hour, every hour you're awake for months, for years. It gets to the point where you can't override it. That's where the neurofeedback helps, but that old pattern is still there. So any like major trauma can push it back in that path. Does that make
Oh,
sense?
thank you. Yeah, that definitely makes sense. And I'm glad to know I'm not the only one who does that.
Oh my gosh, I do it all the time.
Thank you for the example.
All the
I
time.
think we
Yeah,
have
all the time.
Karen with a question.
I do want to ask a question. I want to say thank you so much too. I love brain science, and so I'm nerding out with you, and I really appreciate all.
Oh no, she has a friend.
Yes, totally. I'm like, please keep nerding, keep nerding. I love it. It's very exciting. If you spoke to this and I didn't hear it, excuse me, I'll ask you to repeat yourself. Where does this kind of treatment fit in with insurance? Are you seeing insurance coverage for this sort of stuff, or where it fits, if so?
We're not seeing insurance cover it yet. Flexible spending accounts and health savings accounts, we've had no issues with those. Some, the Christian-based care, like the Share the Care plans, we've had a couple of them cover it, but traditional insurance, they say they do. And Dawn does a lot of advocacy work in that realm, so I'll let you speak to that a little bit.
Yeah, it's a fight. I've been fighting it for so many years. I mean, I meet with legislators, I do all the things. It's really they tell me, so it's not just my opinion. They tell me that really it's a big pharma issue because a lot of the patients that come to us end up off of their meds. My kids were on 4 different medications when we started here, and by the time we finished our treatment, they were on 0 meds, and they've never gone back on any of those meds. Most major insurance companies will cover biofeedback, but not neurofeedback. And it actually violates, there's a law in the books called the parity law. And the parity law says that if you're an insurance company and you cover something for a physical condition, you must also cover it for a mental health condition. So everybody covers biofeedback if you have migraines, incontinence, but if you're suicidal and about to slit your wrist from depression, they won't cover it. So I've met with legislators and said, okay, I get that you don't want to be the guy that writes the bill, that goes against big pharma, right? Because then that's bad. But why don't you just be the guy that tries to enforce the law that already exists? But it's a difficult uphill. I will say this. There is work currently, of course, all of that is decided at the state level, but the puppet master is at the federal level, right? There is some work at the federal level trying to get neurofeedback its own code. So, right now, biofeedback has a code. We use a dysregulated brainwaves code, which they all go, what? I don't even know what that means. So there is some movement at the federal level to get that covered. And then we've seen a couple of companies that have gotten some of the software covered, but it's very scattered. We had one client that we have home units. So we offer in our clinic home units for the neurofeedback portion. All those other therapies you got to do in the office, but the actual neurofeedback we can send home in a box, so to speak, because it's really just software driven on a laptop or on a TV. And we had one client that got that covered as a durable medical device, but nobody else has sense. But so we try to get really creative. But the short answer is
The realms of the law. We're not
I
getting,
mean,
we're not getting
yeah,
creative outside.
we're going to stay within the law. But yeah, I battle that at the state level. I mean, it's just a never ending. I will say this though, I do hear in those conversations that I'm at that there are a lot more natural alternatives being accepted and being covered. So we're hoping that it happens. In Texas, where we are, I was at the Capitol for the last legislative session, and there was a bill on the floor to get neurofeedback covered by insurance for traumatic brain injuries. It failed, but it didn't fail by much. It failed by less than it's failed in years past. So, you kind of take that as a win a little bit. But yeah, it's not covered by insurance. There was a bill a couple sessions ago that wanted to put, this will tell you where the role of the medications are. And again, we're not anti-meds. But there was a bill on the floor to try and put in Texas, public schools, to put a psychiatrist in every school, public school. So you'd have your counselor in one room and a psychiatrist right next door. Then if the teacher says that little Johnny is impulsive and hyperactive in class and sends little Johnny to the psychiatrist, and the psychiatrist says little Johnny has ADHD and you should medicate, and you as a parent choose not to medicate, the way the bill was written, CPS would automatically be called, Child Protective Services. Now that bill failed, guys, by, I mean, a hair. It barely failed. So yeah, we're working on it. It's a tough road. So it is a time commitment. It's typically 4 to 5 months of care to get to that 60 to 80 sessions, and it's definitely a financial commitment. We offer a lot of different discounts and payment options, but typically insurance, we're very upfront about that. You can do it. We'll fill out all the paperwork. You can appeal. I appealed twice.
Yeah.
When my kids were here.
And I wrote letters. We write letters, we give codes, but at the end of the day, goose egg.
Yep.
Well, I think we all need neurofeedback now just to deal with what you're just sharing about the types of bills that are coming up in Texas. Like,
Yeah.
I truly am having a visceral response to that. That's very intense. Thank you so much for that information.
Yeah.
And just, going back to the way ADHD is diagnosed, they use that Vanderbilt questionnaire.
Mhm.
And there have been so many studies showing that it's inaccurate. Even when because they have the parent fill out one, they have the teacher fill out one.
Subjective.
Yeah. And they found that, like, if they had the parent and teacher fill it out 3 months later, fill it out another 3 months, the same teacher on the same student, where there was only like 10% similarity. And with the parent, I think it was 20. And what it boiled down to is if they were having a bad day, they got a bad score. Now, neurofeedback has not been approved for use of diagnosis, but there is an objective measure of attention called a QB test. And you're actually sitting in front of a computer screen with a clicker, waiting for the proper target to come. And when it comes, you click it. And if you have an attention problem and look at that butterfly, you're missing a lot of targets. If you're the impulsive type and anything comes on the screen, you're clicking, you have a lot of over clicks, and that goes on for 20 minutes. So that, I think, using something like that for the basis of a medicine makes a lot more sense.
Yeah. And then, the subjective questionnaire, and then our kiddos are on class 2 stimulants. So it's tough. There's actually that parity law. There's a parity law violation tracking website where you can see violation after violation with the fine associated, but they tell me they would rather pay the fines because, first of all, a lot of people don't know that, they don't pursue it. That paying the fines is cheaper than covering the therapy, and it doesn't make a big pharma mad. So that's, they just violate, but that's just the reality. There's some for those of you that like to geek out, since you found a friend on this on this. No, I'm always just the comic relief, but the website that you see at the bottom of this screen, this isnr.org, if you go there, they have under the resources tab, they have a bibliography that is a compilation of all of the research on neurofeedback, alphabetized by condition. So you can go and look up ADHD, autism, whatever, and see all the research associated with that. So if you really want to geek out, that's where, almost 70 years worth of research sits. I will tell you, I don't know why they're not live links. So you have to copy the case study and put it in Google to make it pop up.
The citation.
Yeah. That's a big doctor word. The link, the citation, whichever. Any other questions we can answer? Oh, sorry, we're delirious by the time Friday comes in the afternoon. We don't know. We close at noon here, so by the time that happens, we're brain dead from the week pretty much. So,
Well, Dr. Agnes and Don, thank you so much for such a great presentation. We appreciate it. And I'm glad we have Karen here. She is, Karen, do you want to give us a teaser of next month's webinar? I think you might be involved in that.
I am involved in that. And I'm excited because so next month's what do you call this? Lunch and learn. Afternoon webinar Friday. You can come brain dead because we're going to do something playful and creative and you'll have a good time. I was smiling today when I saw that we were looking at brain maps because one of the things we're going to play with next week is a mind map. So the title of the session is Don't Let the Whimsy Fool You. Three powerful creative tools for therapy. And I'm going to do one of them right now because it's like really present for me and I'm going to show you. And you could do the same if you're at home and you have a little piece of paper right there. I'm going to make an emoji of how I'm feeling right now. And this speaks to what we were learning about today, mindfulness and coming into the present and really seeing what's going on. So this is my emoji that I just made just now. I'm happy to be here and I'm excited about what we've been learning today. But as I shared a moment ago, I'm having a really strong reaction to this conversation about legislation and insurance and whatnot. And so I can feel like this like a little bit I'm a little dysregulated energy going on at the same time as like feeling really glad to be here and excited to be with all of you. So we're going to play with things like this next week. So bring your scraps of paper and whatever's within arm's reach. I know a lot of people are eating lunch and on the move during these sessions, but if you can, come and participate with us. And yeah, we'll get in our bodies a little bit. We'll get some catharsis a little bit and hopefully some surprises that you can apply in your life right away. Thanks, Jason. Thanks, everybody.
Hey, thank you so much, and thanks again. We did have one final question we might have time for. It says, does neurofeedback help with hoarding disorder?
It can help. I'm trying to think if we've worked with any patients specifically with hoarding.
For the underlying
Yeah.
triggers, right?
Yeah, there's usually an underlying trigger for the hoarding. And neurofeedback can, I would say it's kind of like getting down to the root. And there's a lot of anxiety associated with it.
Often
like
trauma.
and trauma. They can't, well, the anxiety comes when they try and
Right,
not hoard.
right.
But it can be a trauma response, and there's a very specific type of neurofeedback training that's it's called alpha theta training, and that one you don't actually watch a show. Your eyes are closed and you're listening to different sounds that guide the brain into a very deep state of relaxation. It's where the alpha and theta waves cross over each other. And when that happens, the brain is able to integrate trauma without consciously, on a subconscious level, without reliving it.
Or impulsivity. I mean,
Yeah.
there's lots of, and that's what often happens, is we end up treating that root cause, sort of the core triggers of it. So there's not like a hoarding protocol. But depending on what parts of the brain are dysregulated can lead to those behaviors. So hope that answers the question. There is one, let me just say one more thing as we wrap up. There's, we treat probably 90% of what we see in our clinic are people who are struggling with their mental health. But there are other areas that neurofeedback is used for. There's the medical area, traumatic brain injuries, strokes. We treat a lot of migraines, fibromyalgia, phantom limb. We've treated some phantom limb patients. Then there's the peak performance side of neurofeedback. We, CEOs, athletes, NASA uses it on all their astronauts. London Symphony uses it on the entire orchestra just to be sharp. Yeah, if you saw the show, Quarterbacks on Netflix, episode 4, Kirk Cousins talks about, he's done it for years. He does it every day because he has a horrific memory and he can't remember the plays. So he does it for concentration and memory. So there's we treat a lot of age-related cognitive decline. It's used for a lot of different things. We've failed to mention that, but no, we plan to wrap with that. That's what it was. We plan to wrap with that.
It sounds like you did, Dawn. I appreciate y'all. Thank you so much for coming on. And we look forward to next month with Karen, and definitely look forward to the interactive part of that. And again, thanks to Freed-Hardeman University for sponsoring and hosting us. Parker, we appreciate you. And Thank y'all so very much. Remember to go to spiritualcarenet.org, find out about membership, and find about all of our networking events and conferences. We have it all listed there. So thank y'all, and y'all have a great one.